Well, good afternoon, everybody, and welcome to Psychiatry Grand Rounds. My name is Tony Rothschild, and I'm the chair of the Grand Rounds Committee. Couple of announcements. When you signed into Grand Rounds, you're signing in, but in order to receive credit for attending, please fill out the evaluation which came with the Grand Rounds announcement on Monday from Karen Lambert. Grand Rounds will continue to be on Zoom for the rest of January and February, and we will be making a decision regarding March fairly soon, but whether it'll be in person or not, I think most likely not, but it always is available on Zoom. If you have questions for today's speaker, please type them in the chat function, and the speaker will be asked the questions at the end of her talk. Grand Rounds will be given by one of our child fellows, Dr. Ariel Graham, and the title of Dr. Graham's talk is What to Expect When There Are Treatments for Not Expecting: The Importance of a Multidisciplinary Approach to Pregnancy Denial. It's my pleasure to introduce Dr. Lala Padija, who will introduce today's speaker. Dr. Padija is the director of the Psychiatry Residency Program and chair of the Diversity, Equity, and Inclusion Committee in the Department of Psychiatry. Dr. Padija.
Good afternoon, everyone. Thank you for being here, and thank you, Tony, for that introduction. It is my pleasure to introduce you to our program chief resident and chief resident of geriatric psychiatry, Dr. Emily Federo Hungrier. Dr. Federo Hungrier completed her Bachelor in Science at McGill University with a major in anatomy and cell biology and a minor in social studies of medicine. She obtained her medical degree from UMass Medical School. Prior to medical school, she worked as a resident support staff at the Seventh Hills Foundation, which put her on a path towards a career in geriatric psychiatry. She completed a research project on HIV-associated dementia in the Dominican Republic, a consequence of stigma, domestic abuse, and limited health literacy, published in the British Medical Journal, or BMJ. During her training, Emily has been invested in education and has helped coordinate numerous lectures and seminars. She received the UMass Department of Psychiatry Medical Students Semi-Annual Teaching Award, as well as the American Association for Geriatric Psychiatry Scholars Program Award. In addition, she was once a member of the UMass Psychiatry Student Interest Group and now serves as the resident mentor to that group. Emily has co-led social events for our group, our psychiatry film series, and has co-led our department's NAMI Walk team for 3 consecutive years. After graduation, she will be pursuing a fellowship in geriatric psychiatry at Brown University, and hopefully we will see her again once she has completed her training. Today, she will be talking to us about dementia, caregiver burden. Please join me in welcoming Dr. Federo Hungrier.
Thank you for the introduction, Dr. Padilla. Let me see if I can share my slides. All right, and let's see if I can start slideshow. Great. So welcome everyone to my Grand Rounds on Dementia Caregiver Burden. I have no conflicts of interest or disclosures to report. The objectives of today's Grand Rounds will be to define caregiver burden, to discuss the impact of COVID-19 on caregivers of people with dementia, and to describe local resources in Central Mass available to caregivers of people with dementia. Another thing that I'm really happy to share with everyone today is I have a video of the caregivers themselves, like sharing their experiences with you. So I've been rotating in the neuropsychiatry clinic where I see people with dementia, and 2 of the caregivers that I've met with there agreed to share their experiences of caregiving today. And so I did just see just now that one of them, Gloria, is in the audience, and the other caregiver, Maria, might join in as well. So thank you to them for joining and for participating in the video. So just to start this Grand Rounds by defining what caregiving is. So caregiving refers to attending to another person's health needs and well-being. Caregiving often includes assistance with activities of daily living, such as bathing and dressing, as well as instrumental activities of daily living, such as paying bills, shopping, and using transportation. Caregivers also provide emotional support, coordinate care with other family members and healthcare providers, ensure safety at home and elsewhere, and manage health conditions. So caregivers can be paid or unpaid. So paid or formal caregivers would include those working in a nursing home, for example, and unpaid caregivers or informal caregivers include friends, family, neighbors of those with dementia. And so for the purposes of this talk, I will be focusing on the unpaid or informal caregivers of people with dementia. And the caregivers of people with dementia are going to be super needed because it's expected that there'll be more cases of dementia in the United States as the population ages. So the population of Americans aged 65 and older is projected to grow from 58 million in 2021 to 88 million by 2050. It's estimated that 6.2 million Americans aged 65 and older were living with Alzheimer's dementia in 2021. And the annual number of new cases of Alzheimer's and other dementias is projected to double by 2050. So who are the caregivers? So this is a slide of just some demographic info of caregivers. Approximately 2/3 of dementia caregivers are women. About 30% of caregivers are age 65 and older. 2/3 of caregivers live with the care recipient. Over half of caregivers are providing assistance to a parent or in-law. 10% of caregivers provide help to a spouse with dementia. And 41% reported that no one else provided unpaid assistance to their care recipient, or that they were the sole caregiver. Racial demographics of caregivers in the US: 2/3 of caregivers are white, 10% are Black, 8% are Hispanic, 5% are Asian American, and the remaining 10% represent a variety of other racial and ethnic groups. And the work that these unpaid caregivers is of huge value to the people with dementia that receive their support, but also of huge economic value to society as well. So in 2020, more than 11.2 million family and other unpaid caregivers provided 15.3 billion hours of unpaid care to people with Alzheimer's and other dementias. And this is at a huge economic value of $256 billion. And so to put $256 billion in context, that's half the total revenue of Walmart about in the year 2020, and 10 times the total revenue of McDonald's in the year 2019. So a huge amount of money. 70% of lifetime cost of care for people with dementia is borne by family caregivers in the form of unpaid caregiving. And a dementia caregiver today is providing on average 20.2% more hours of care each week at an average of 26 hours a week compared with a dementia caregiver a decade ago. And so now just to switch focus here to talk about caregiver stress, burden, and burnout, and just to define what these terms mean. So caregiver stress has a pretty intuitive definition. This is one that I was able to find. Unequal exchange of assistance among people who stand in close relationship to another. So basically being a caregiver, which results in emotional and physical stress on the caregiver. So caregiver burden is a little bit more complicated of a term. So what this means is a multidimensional response to physical, psychological, emotional, social, and financial stressors associated with the caregiving experience. And another definition, this is separate from caregiver burnout, which is a state of emotional exhaustion caused by excessive psychological and emotional demands made on people helping people. And so this is some data about caregiver stress. So this is a poll that was done by the Alzheimer's Association, and they asked respondents what percent of caregivers reported high to very high stress due to caregiving. And what they found was that 59% of caregivers of people with dementia reported having high to very high emotional stress of caregiving, and that 38% of caregivers reported high to very high physical stress of caregiving. And we can imagine how caregiving for someone with dementia can be physically stressful, especially with providing assistance with activities of daily living. There are racial disparities in caregiver burden and depression. So Black caregivers are more likely to provide more than 40 hours of care per week than white caregivers. Hispanic, Black, and Asian American dementia caregivers have less outside help or formal service use when compared to white caregivers, and also indicate greater care demands. And then Hispanic and Asian American dementia caregivers indicate greater rates of depression when compared to white caregivers. It's unclear at this point whether Black caregivers experience higher or lesser rates of depression than compared to white caregivers, and more work needs to be done in this area. So to talk about caregiver depression, caregivers can experience a huge amount of depression. So 30 to 40% of family caregivers of people with dementia report depression, compared with 5 to 17% of non-caregivers of similar ages. The prevalence of depression is higher among dementia caregivers than other types of caregivers. So for example, caregivers of people with schizophrenia or stroke. And the type of relationship with the care recipient was the strongest predictor of caregiver depression in people with dementia, or caregivers of people with dementia. So caregivers of spouses with dementia have 2.5 times higher odds of having depression than non-spouse caregivers. And so it's been known that if the person with dementia has behavioral and psychological symptoms of dementia, that this can contribute to the caregiver's burden and depression. However, I included this study because it looks at what amount of behavioral and psychological symptoms of depression in the care recipient does the caregiver start experiencing burden and depression. And what this study found was, looking at the 16 symptoms that they included in this study on the right of behavioral and psychological symptoms of dementia, they found that caring for people with dementia who have greater than or equal to 4 behavioral and psychological symptoms represents a tipping point for family caregivers, as at this point they're more likely to report clinically meaningful depression and burden. And so they found that this finding was 85% sensitive for depression and 84% sensitive for burden. And so what the authors of this study suggest is, if you're in your office and you have a patient with dementia who's experiencing greater than 4 or equal to 4 behavioral and psychological symptoms, so that this can tip off the provider to be aware to maybe screen or be more concerned that perhaps their caregiver is experiencing caregiver burden or depression. There is an impact on the caregiver's health as well. So caregivers of people with dementia are estimated to lose between 2.4 and 3.5 hours of sleep per week. And we can imagine how this might happen, especially if the person with dementia is waking up multiple times a night. A 2017 poll also found that 27% of dementia caregivers reported that they delayed or did not do things that they should do in order to maintain their health. And this can happen if the caregiver, they're so busy spending time caring for their care recipient, perhaps they are unable to find time to care for themselves. There have been some studies that show that the chronic stress of caregiving may be associated with an increased incidence of high blood pressure, elevated stress hormones, impaired immune function, slow wound healing, and coronary heart disease in caregivers. However, there is mixed evidence on the impact on caregiver mortality. So some studies show that perhaps caregivers live longer due to being a caregiver, and some studies show that perhaps caregivers have increased mortality risk due to being a caregiver. One of the reasons that's postulated that perhaps why some studies show that caregivers are living longer, even if perhaps they have higher stress hormones or blood pressure, is that perhaps the people that choose to be caregivers at baseline are sort of a healthier group, and they're able to assume the responsibility of caregiving. And so perhaps that skews data that caregivers at baseline might be healthier than the general population. And then also another thing, one study has shown that 18% of caregivers with dementia do pass away before their care recipient with dementia does. And so those past 2 slides were focusing on the impact of caregiving on the health of the caregiver. However, this slide looks at the impact of the caregiver's health on their care recipient's health. And so this was a study that found that poor caregiver mental health predicts mortality of dementia patients. And you can see the survival curve here on the right. But this study found that they looked at 176 caregiver dyads. It was conducted between 2007 and 2016. And what they found was that worse caregiver mental health predicts patient mortality, even when accounting for key risk factors in patients. All this being said, though, there are huge benefits to caregiving as well. And so you can look here in this graph on the left, and this was a survey that asked caregivers to what extent they agreed with the following statements. And so 45.7% of caregivers agreed very much that helping the care recipient made them feel more confident. 52% agreed very much that helping the care recipient taught them to deal with difficult situations. 68% agreed very much that helping the care recipient brought them closer to them. And then 86% agreed very much that helping the care recipient gave them the satisfaction that they were well cared for. And the Alzheimer's Association has also done research in this, and they found that 45% of caregivers of people with dementia report that providing help to someone with cognitive impairment was very rewarding. I'm going to switch gears here to talk about caregiving during the pandemic. And so, as you can imagine, there's a huge impact of COVID-19 on the experience of being an informal caregiver. So people experience disruption of home services like Meals on Wheels, like home health care workers. So you can imagine how like physical therapists or occupational therapists, maybe less people coming into the home to help out. Closure of respite services as well. So some adult day health programs might need to be closed due to COVID outbreaks. Also like in-home help to give the caregiver a break from caregiving, maybe less people that are coming into the home. There's been a disruption in caregiver support groups, and I'll talk a little bit more about this later, but a lot of caregiver support groups were happening in person, and then with the pandemic, a lot of them shut down, although many did go to online format as well. Caregivers may also experience increased social isolation due to the pandemic, especially like if living with the care recipient, trying to maintain social distancing and keep their care recipient safe. But then also caregivers who are not living with the care recipient, trying to keep the person with dementia safe, might have tried to visit less often and spend less time with them in order to keep them safe. Unfortunately, there's been limited research on the impact of COVID-19 on the health and well-being of informal caregivers of people with dementia, but this is a rapid systematic review that I was able to find. It took place in March of 2021, and they included 10 studies in this review. At that time, none were conducted in the United States. But what they found was really what you would expect, that caregivers experience increased levels of burden, depression, and anxiety. So since that systematic review was published, I was able to find 2 studies that took place in the United States. And I decided to include this one on the experience of family caregivers of people with dementia during the COVID-19 pandemic, because I really feel like it mirrors what I've heard from caregivers of people with dementia that I've been talking with in the neuropsychiatry clinic. And so although this study had a small sample size of only 21 participants, the format was an hour-long phone interview. And what they found was that they picked up on some themes of the phone interviews with the caregivers of people with dementia. And they found that caregivers experience feelings of isolation and loss of socialization. However, some caregivers experience neutral feelings about the pandemic. So some caregivers said, due to being a caregiver, I was already pretty socially isolated. I was spending a lot of time at home caregiving, and that the pandemic really didn't change things for me anyway. Many caregivers reported concerns about the pandemic's effect on their relatives' disease progression. So you can imagine how this would happen if, for example, like the person with dementia was going to an adult day health program, but then that program closed and then they were having less social interaction. There were concerns about contracting the virus. Many reported that caring for the relative became more difficult. Some reported increased sense of reliance for COVID-19 safety precautions. And what that means is like this increased level of when you go out in public and like making sure that the person with dementia is remembering to social distance from other people, to wear their mask, to sanitize their hands, wash their hands, that kind of thing. Caregivers reported a loss of access to dementia-related support groups, and they had mixed views on virtual resources. And of note, there's been studies that show that 2/3 of Medicare recipients have access to virtually, but only 1/3 do not. And so especially older adults that are caregivers might not be able to access virtual resources. So now I'm going to switch gears here to talk about how to help caregivers. And first, I'm going to talk about some interventions to assist caregivers. So these, in the box on the left, there's a lot of different things that have been tried. And so psychoeducation, like lectures, discussion, books, including this one here on the right, the 36-hour day, has been around for a long time. Online resources as well. Case management. So in the support group that I'm in with Dennis, a lot of the caregivers say that case management has been super helpful for them for assisting care, to make caregiving easier. Counseling and psychotherapy is included. Behavioral management and skills training. So if the person with dementia is, has a lot of behavioral and psychological symptoms of dementia, getting skills to work with that. And one of the models, there are many out there, but one I've included here on the right is the DICE model. Support groups as well. So caregivers can talk to other caregivers and get emotional support or tips and tricks of caregiving. Respite services like in-home care, day programs, extended stays. And I included this last one on purpose in these slides, and that's reporting elder abuse. So if the person with dementia is being neglected or abused, it's super important to report abuse to make sure that the caregiver is getting supports to help them in their caregiving role, and to make sure that the person with dementia is safe. So I've seen this included in other presentations on helping caregivers as well, and I think it's super important. So there's a lot of data, like studies out there about which of these interventions is the most helpful. And unfortunately, it's not clear like what is the most helpful intervention at this time. So this is a review that looked at the 10 interventions listed here in the left-hand box to see if any stood out as being most helpful for depression, anxiety, or burden. And what they found was that maybe for caregiver depression, a psychoeducation, counseling, mindfulness, and multi-component intervention approach might be the most helpful, but the effect sizes were rather small at 0.3. For caregiver anxiety, nothing really stood out amongst the rest. And then for caregiver burden, maybe therapy got more consistently positive reviews, but once again, a very small effect size of 0.2. And so part of the reasons for this is, the idea that maybe different caregivers might need different things. And if you just throw one intervention at all caregivers, what might benefit one caregiver might not be as helpful for another caregiver. And one of the things that perhaps contributes to this is that as the progression of dementia, like as dementia progresses, there might be different needs at different stages in the disease. So at the mild cognitive impairment stage, like maybe education and support, advanced care planning, care coordination skills might be most helpful. But maybe at the severe stage of dementia, like grief counseling, social support, and knowledge of palliative strategies might be most helpful. And so now I'm going to switch focus here, and I'm going to stop sharing my screen so that we can watch a video of the caregivers themselves talking about what their experience caregiving has been like. These are caregivers of people with dementia that I see in the neuropsychiatry clinic. So to share their stories here today with everyone.
I think getting all the information of where to go, because at the beginning I didn't know, and I really didn't understand Alzheimer's or I can't remember the organization, but the doctors gave me a phone number in a website for people that helps with families with Alzheimer. And we had a meeting. We have a couple of meetings actually. We have one meeting with my daughter and me, which we are the primary carers. And then we had a meeting with the whole family, so the whole family could understand the situation and how to deal with the specific things like conflicts in the family. You know, how different it is with her now that she's suffering from this.
What I learned is that having a routine means everything. If I didn't know what I was going to do throughout the day, I think it would be so difficult. We don't get to everything that I plan or that he would like to do, but at least it's in both of our heads to have a routine. I know that I have people I can reach out to, like physical therapists, nurses, our own doctors here not far from us. And I've learned that it's okay for me to ask for help from family and friends, but we do it day by day, and I can't ask for more than that. Day by day, I can handle it, and he can too, and our routine keeps us sane. The lessons I've learned is, first of all, I'm glad I'm a morning person. My husband is not. So while he's sleeping, I get up early, usually 5:30, 6 o'clock. And I need my coffee. I relax. I say my prayers. It's very important for me to calm myself down and be in a place that I know I can give him the care that he needs. And I accept, every morning I accept that it's not going to be an easy day. And I'm not perfect, so I'm not going to have a perfect day, and I know that, and it's okay. because every day begins and it ends. So every day is a new chance for me and a new chance for my husband. My husband and I, one of the gifts we have, we love each other very much, and we forgive each other often, because sometimes when I think I'm doing okay, I'm being too hard on him, and I can tell, and I apologize. And other times he can be hard on me, and then a few minutes later he apologizes. So we give and take, and that's the way our married life has been. We've been married, it'll be 52 years.
You know, the truth, what can happen in the future.
Mm.
And so it's very scary. You know, I think it's mostly for us, because we're gonna, like, you know, I didn't know that that her body's gonna forget things. And that is a tough thing. It's scary, but the more I hear, I think I don't know, I don't think we are gonna be prepared, but at least I'm informed. To find support that could be devastated. Now I know that every time if I see something or if I have a question, you know, I can either go to the doctor or go to the Alzheimer's Association.
I wish I knew at the beginning that I'm stronger than I ever thought I was. I'm stronger. I am strong physically, and I'm strong mentally. The other thing, when we go out, the wheelchair is 32 pounds, and I have a problem taking it out of the car. There are so many good people. So many times another woman will come and say, can I help you with that? Or a man will say, oh, let me help you. And then he'll literally take my husband out of the car and put him in the wheelchair. So we're not afraid to go out together. You know, I thought, oh my goodness, when I found out what we were dealing with, I thought, we're going to be hermits. You know, what are we going to do? You know, the problems that people go through, and for as long as I can, I want them to be home with me, and we get through the day really well, really well. And the therapists even say, how come he can walk with you, but he has a hard time with the rollator and the walker? You know, it's a clunker, it's hard for him, but he takes my hand, and I'm Martha Washington, he's George, and we walk down the hallway together. So it works so far. The other thing, I wish I knew that my children were going to step forward. You know, everybody comes together to help in our family, and I am very blessed for that, and my husband is too. We have a wonderful family. If the rest of the world is staying home, that old adage, there's no place like home, it's so true. There's no place we want to go. We'll go to our children's homes as long as no one has COVID, but we're perfectly content to be at home. And if we can't be at home, like if we want to get out, we hop in the car and we go for a ride. We put on our favorite CDs, and that's our mini vacation, and we love it together.
It's very bad, because when she got COVID at the beginning, and we got COVID, we all got COVID, and that's when my father passed away. And she thought she was lost, and through the whole thing, she thought that she couldn't find us, and she was going through a lot of stuff that I couldn't understand, and it was very tough. You know, like now she gets things like, oh, you have to wear the mask, and she remembers to wear the mask. That gives me a little bit of hope that she will grasp some information. She knows about COVID, and you know, like I tell her, you need to take care of yourself, and she, you know, but it's very scary, because I know that she might forget to clean her hands, and you know, she goes out or things like that. So we are very protective of her, and trying to have all her medicine on time, and her vaccines, you know, everything that we can do to protect her from COVID, that beside the mask and cleaning her hands in case she forgets. She remembers everything from old times, and sometimes she also she never complains before, and now sometimes she complains. You know, she was telling me today, I told her tomorrow you're not going to the program. And she said, finally, I'm gonna be resting because I'm tired of going there. You know, things like that. And she would never do anything like that before. You know, like at the beginning, they were telling me that she fights, and I'm like, no, she would never do. And now she does. You know, sometimes she's like, no, it's my way, not your way. You know, and it's funny because now I think she has more voice now than before, because now she doesn't care. She says what she feels.
The bright spots, I didn't think there were going to be any when we discovered what he was going to have to undertake. But we took what we loved to do in the past and we brought it into the now. And one of the unique things for what my husband has, he can remember songs from the 40s and 50s that his father used to sing to him. He remembers the words, and we'll be driving and out of the blue, I'll say a sentence and there's something in the sentence that clicks for a song for him, and he'll look at me and he starts singing, and I love it. I just love it. One of our favorite CDs, one of our favorite CDs is by Neil Diamond, and there's a song he sings that says, "Play Me," and part of it is, "You are the words, I am the tune. You are the sun, and I am the moon." Well, I have the words, and my husband has the tune. And we say that when we sing in the car, we both cheer up because it's true. I'm the left hand, he's the right hand, or vice versa, but it makes us happy. We laugh a lot. He does such silly things, you know, and I do too. Sometimes I have trouble speaking clearly, and he'll pick up on it, but we do laugh a lot. We say, "I love you" often, many times during the day, and that's important for me to hear from him. What else? Our grandchildren are just amazing. When one of my granddaughters was 6, she discovered she liked to write, and she wrote on a little piece of paper with a heart to my husband, "I love you to my heart," and in the heart. And she took it without us knowing, and she put it on his bureau, and he found it. And for her to be so tender, and they all are, they love to give him hugs and kisses, and it's so sweet for me to see them love my husband so much, because I love him with all my heart. And that's my story.
So I'm super grateful for Gloria and Maria for sharing their experiences caregiving with everyone today. And I think Gloria, at least I saw, is in the audience. So I'm super glad I was able to share that with everyone. So that's really my favorite part of my talk. Let me get back to my slides so I can share you my second favorite part of my talk. And let's see. Share screen. All right, can everyone see local resources? Okay, so with this slide of myself inside of the interesting Worcester landmark of Bancroft Tower, I'm gonna switch gears to start talking about resources available in the Worcester area. So first, I'm going to start off with talking about the Alzheimer's Association. So in preparation for this talk, I was able to meet with a lot of really cool people that are doing great work locally in Worcester. And so one of them was Julie McMurray from the Alzheimer's Association. So I was able to meet with her and learn more about what they do locally to help caregivers specifically. And she told me that the Alzheimer's Association, like they are a national organization, and the association's main mission is to eliminate Alzheimer's disease through the advancement of research, to enhance the care of those diagnosed and their caregivers, and to reduce the risk of developing dementia. The local chapter is the Massachusetts, New Hampshire chapter, and their main office is in Waltham. They do have smaller offices as well, including one in Worcester, which was temporarily closed, but they're planning to reopen on February 1st. When I last spoke with Julie, this was in December, so I don't know if the increase in cases with the pandemic has changed these things, but between our two states, so the Massachusetts and New Hampshire, like those are the two states in our chapter, There are estimated to be 156,000 people living with Alzheimer's and 338,000 caregivers in our region. And so the two programs listed on this slide are offered by the Alzheimer's Association and totally free. So the first is the 24/7 helpline. And so people can call this helpline any time of day, 7 days a week, and speak to a master's level clinician. And this is their gateway to accessing programs and services. So this is what Alzheimer's Association views as their gateway to like getting resources through them. And so this resource, they can help with like a lot of different things. So finding an elder law attorney, finding assisted living facilities, learning about the diagnostic process for Alzheimer's, learning about where to go to get a diagnosis, and really just for emotional support too. And so this is separate from the care consultation service that they offer. So the care consultation program is meeting by appointment with a memory specialist, and it's a little more in-depth. And so they do an in-depth assessment with the caregivers regarding planning and problem solving. And based on the situation, they can help with a lot of different things. So this can be like getting services, community resources, communication strategies. So right now this is all virtual, but in the future they're hoping to offer in person again. And so one of the things we can do as providers to set up patients with this care consultation program, if we think caregivers would benefit from this, is that we can, through this hyperlink I've included here, which is the Dementia Care Coordination Program referral, we can refer caregivers to this service. So if we have someone in our office with dementia and we feel like their caregiver might benefit from this service, it's super easy. Just go to the hyperlink, and on this form that you have to fill out, it's pretty short, and it just asks for like contact info for the caregiver, whether or not they consent to be contacted. And you can click off different areas for concern. So this can include things like behavior management strategies, communication techniques, caregiver stress, family dynamics, like a lot of different things that can help. And so when I was able to speak with some of the geriatricians here at UMass, including Dr. McGee and Linda Pellegrini, they said they've had really good success with this program in the past. And generally what happens after the Alzheimer's Association receives this referral, they're able to set up one of these care consultations with the family within about 2 weeks. And after the meeting, they give the family like a list of everything that they spoke about, and then they'll send the same list of what was spoken about and like next steps to the provider that did the referral as well. So it's nice because it keeps the provider in the loop about what's going on. And then next, okay, made it to the next slide. So this is something else that the Alzheimer's Association does. So they have virtual education programs as well. So before the pandemic, they were offering a lot of education programs in person, but with the pandemic, they've moved a lot of these to online. So some of them are offered online live. So this is great because it allows the caregivers the opportunity to participate and ask questions, but also a lot of them are pre-recorded. So the caregivers at their own convenience can join in on, watch one of these education programs and learn at a time that's convenient for them. Julie did say that they were able to offer some in the Worcester area live this fall when cases were a bit lower as well. So they had about 4 in our area this fall. Another awesome things that the Alzheimer's Association does is they offer caregiver support groups. And so when I spoke with Deb Dowd-Foley of Elder Services of Worcester, she said that the support groups in our area, a lot of which happened in person before the pandemic, were really decimated by the pandemic and haven't quite recovered to the previous amount that we had. However, a lot of them have moved to a virtual platform, and some, when I last looked on the Alzheimer's Association website, were happening in person. But so they have like some that are by town, and I listed some Worcester, some central Massachusetts towns here, but they also have many that are occurring virtually right now for different stages of dementia. So they can group caregivers like by early stage of Alzheimer's, middle stage, late stage of Alzheimer's together within a group for the Massachusetts, New Hampshire chapter. So the caregivers are sort of going through something similar at the same time. And the people that facilitate these groups are trained by the Alzheimer's Association and screen caregivers before they join the group. They also have some specialty support groups as well. So like for adult children and people with frontotemporal dementia, for LGBTQ caregivers and younger onset dementia as well. I've included in the upper right-hand corner of this slide an ad for the caregiver support group that occurs at the Worcester Senior Center. And this is my last slide about the Alzheimer's Association, but this just really highlights the wonderful work that they do in our area. So this is data solely from the Massachusetts, New Hampshire chapter, and this is from the year 2020. They won't have their data published for 2021, I hear, until about I think it's March is what Julie said, but really they do a lot of great work. So over 12,000 people reached, over 85 association trained support groups running in the year 2020, 10,000 calls to the 24/7 helpline, almost 4,000 care consultations provided to families at no cost, and about 2,200 direct referrals from healthcare providers. So really a lot of great work in our area. I'm going to switch gears to talk about Elder Services of Worcester here. So I spoke with Deb Dowd-Foley, and she's a caregiver specialist at Elder Services of Worcester. So Elder Services of Worcester's main mission is to help older adults and their families obtain essential services so that elders can remain at home with dignity and independence for as long as possible. Elder Services of Worcester area is one of 27 aging service access points in Massachusetts. And so for Worcester County in general, there's this graph here on the right. And so Northern Worcester County, it used to be called Montechusett Home Care Corporation, but since they've changed their name to Aging Services of North Central Massachusetts. For Worcester, it's Elder Services of Worcester area. And then for Southern Worcester County, it is Tri-Valley. And so those are the aging service access points for Worcester County. And so Elder Services of Worcester can also give information on caregiver support groups through them. And so Deb Dowd-Foley, as the caregiver specialist, she's able to really help out caregivers and has a lot of knowledge about what's happening locally to help caregivers. She can offer one-to-one consultation about caregiver needs. And she's a huge wealth of knowledge, especially about respite programs like contracts with adult day health programs. Elder Services of Worcester has contracts with home health agencies. So after her and I met, she was able to send me a list of all the stuff that's going on in the area and how much each of these adult day health programs cost, these home health agencies, that kind of info. So a huge support there. Other cool stuff that Elder Services of Worcester does is they publish this caregiver's guide that I've included in the bottom left-hand corner. And this is available online completely free. It's about a 100-page PDF. So it's really long, but it has a lot of helpful information for caregivers, and it's specific to Central Massachusetts. So that's a great resource they have. Another thing that I didn't include on the slide, but another awesome thing that Elder Services of Worcester does is that they have scholarships available to caregivers. So if a caregiver might benefit from something that might make caregiving easier, and Deb Dowd-Foley knows a lot of things, but technology to make caregiving easier. So using fidget blankets if someone has picking behaviors, or buying locks for doors, or getting bed alarms, or video monitoring to make sure the person with dementia is staying safe. But the caregiver can't afford it. They're able to apply for a scholarship through Elder Services of Worcester and can receive $600 to spend on anything that makes caregiving easier. And this could include respite services as well. They don't ask for the applicant's income when they apply. So this is a huge thing that might help a lot of our patients. And another slide about Elder Services of Worcester, and this is a program that Deb Dowd-Foley also runs, but this is the Savvy Caregiver. So the Savvy Caregiver is not specific to Worcester. This is a program that is all over the world. I was looking at studies of the Savvy Caregiver in Italy, it's everywhere, but it's nice that we have one offered locally in Worcester. So this is a 6-week workshop, and it's available to all caregivers of loved ones with dementia. And a psychologist created this program as a way to educate caregivers about the disease. It's about 2 hours commitment each week, and it takes place on 6 consecutive Thursdays. The caregivers get a free book, and in this program, they're educated a lot about various things, including communication skills. It's totally free, if I forgot to mention that by now, but it's available it takes place in Worcester, but people from surrounding towns can come in as well. In between the Savvy Caregiver workshop sessions, the caregivers are assigned homework to practice with their loved ones with dementia, and also assigned readings in the book that they're given. And so right now they limit participation to 10 participants at a time. Before the pandemic, these were happening in person, but they have been able to adapt successfully to a virtual platform. So back in May and June, Deb Dowd-Foley was telling me that they ran it virtually and that it went really well. And they also did one in September, October, and that one was able to happen in person. And when I last spoke with her, she was saying that she's hoping maybe for this month or next month to offer another one virtually. So a really great resource in our area. So now I'm going to speak about the Worcester Senior Center. So the Worcester Senior Center, they have such a robust schedule. When I went on their website, I was so impressed. Like there were different activities going on at like all hours of the day when I was looking in December. I did see on their website that they are closed for safety for the month of January, but generally they do offer a ton of programs for older adults, including like things like billiards, ping pong, games, craft classes, fitness, exercise classes. They said that there's lunch as well, but it has to be reserved. So reserve your lunch, computer labs, community gardens. And they said that, due to the pandemic, closed in January. And I'm sorry if there's some sounds from construction happening outside of this office. Not sure if you can hear it. So a lot of the activities I've already spoken about. So I talked about the caregiver support group that takes place there. And I'll talk about Memory Cafe on the next slide, but they do have a respite day program that I really wanted to highlight that takes place there that's completely free. So this could be a huge resource for patients. Right now, they're only able to accept about 7 to 8 people, and I think there might be a waiting list, but it takes place on Wednesdays, and it runs from 10 a.m. to 2 p.m. And so this is a place where caregivers could drop off their loved one with dementia and get like a 4-hour break from caregiving to take care of their own needs. They do like, and there's a photo of this in the upper right-hand corner of the people with dementia participating in this, but they're able to enjoy activities together, have lunch, and enjoy company of their peers with trained staff there. And so that's their respite day program, really awesome resource. And the last photo in the bottom right-hand corner of this slide, just to show that the Alzheimer's Association does have a presence at the Worcester Senior Center as well. So this was a training that the Alzheimer's Association, or like a education session that the Alzheimer's Association did in fall of this year that happened in person at the Worcester Senior Center. And it was offered in Spanish, and it was about the 10 warning signs of dementia. This is my second to last slide. And so this is about memory cafes, which is a really cool thing. So memory cafes, so the idea is that a caregiver brings their loved one with dementia to hang out with other caregivers and other people with dementia to enjoy the company of other people, to have refreshments, entertainment, and activities. So it's separate from like a drop-off or a support group because the caregiver and the person with dementia are spending time together. And so this was an idea that emerged in Europe, and it based on the idea that a lot of caregivers might enjoy to go out and socialize and spend time with their loved one with dementia, but also out in public may experience a lot of stigma or might feel judged by others. And so this is a way for them to have a social experience with other people that have dementia and their caregivers, and kind of like a safe environment. And so it was started in Europe, and then it came over to the United States, to Wisconsin. And what I learned about the history of how it kind of came to Massachusetts was that someone from the Jewish Family and Children's Service out of Waltham held a conference and wanted to start one. And so Deb Dowd-Foley, who works at Elder Services of Worcester, her sister Patty works at the Worcester Senior Center. So Patty met up with this person from the Jewish Family and Children's Service and learned about it and decided to bring this to Massachusetts. So we've had memory cafes in Central Mass since the year 2018, so still kind of a newer thing, but they've really blown up. So you can see in this right-hand box here that there are a lot of towns that offer memory cafes. And so, for example, the Shrewsbury Library has one. Their memory cafe, as of December, was happening twice a month. And one of those was happening virtually, and one was happening live at that time. And from what I hear, the Shrewsbury Library likes to do a lot of music for their memory cafe. But I've included the ad here for the one that happens in Worcester itself here on the left. But the Memory Cafe here in Worcester, they do a lot of different things as well. So like in the past, they've done floral arrangements, they've done games, they've done a chair exercise program, meditation, crafts. And I hear that they draw a pretty good crowd too, like about 16 people on average. And so last month for December, they were planning to go to see an organist from Europe perform live. They've done trips in the past to places like Tower Hill Botanical Garden. And so, I skipped a lot of slides. Let me go back. Okay. So another thing too, so the Alzheimer's Association does something somewhat similar, and they're called ALS meetups. But the difference between like a memory cafe and an ALS meetup, from when I was speaking with Julie McMurray, is that the ALS meetups are kind of more geared towards people with dementia that are in the earlier stages of dementia, whereas the memory cafes are more geared towards people in the early and middle stages of dementia. But the Alzheimer's Association does ALS meetups in our area as well. Currently, or when I last spoke with Julie in December, they were all virtual at that time, but in the past, they've done a lot of cool trips as well. So they've also gone to Tower Hill, they've gone to the Worcester Art Museum. When I spoke with Julie, they were talking about maybe in 2022, going to the Museum of Russian Icons in Clinton, Massachusetts. So a lot of cool stuff going on there. And this is my last slide. So this is a really awesome program that the Fitchburg Art Museum has, and it's called Hidden Treasures. And so this program has been like featured in national newspapers. It's really cool. And what it is a specialized art appreciation program for individuals with early to middle stage dementia, and it's led by specially trained staff and docents at the museum. And they identify their mission is to offer adults with Alzheimer's and their caregivers a meaningful, purposeful, and pleasurable experience in a museum setting. And so this did take place in the fall in person. It occurs once a month from 1 to 3 p.m. And it's open to all individuals with dementia and their caregivers. During COVID, they have been requiring pre-registration and limiting participation to 16 people total. When I checked on their website this month, due to the increase in COVID cases, they have decided to switch to like self-guided tours for this month, but they are planning to go back to having it with a group of people like you can see here in this photo in February. And so that was my last slide. And I really just want to thank a lot of people here today. I spoke with a lot of people to learn more about caregiving and what's going on in Central Massachusetts. So first and foremost, I really want to thank our caregivers, Maria and Gloria. And I think I saw Gloria in the audience today just for sharing your experiences with everyone. Like, I'm so grateful that you were able to do that. And I think it was really important for the people attending today to hear what you have to say. Then also thank you to Dr. Richler, who helps me a lot in the early stages of this presentation, just to kind of give me some ideas about what to think about, where to go. I'd like to thank Dr. B for giving me the idea to interview caregivers and include the video in this presentation, and for allowing me to use his office for this presentation today when the Wi-Fi in my office was not that great. And Dr. DeGresh for her help with assisting in making the video. I'd like to thank Dennis for allowing me to participate in his caregiver support group and hear more from caregivers themselves. Dr. Brown for putting me in touch with a lot of people, including Dr. McGee and Linda Pellegrini, the geriatricians at UMass, and for them speaking with me. Deb Dowd-Foley, whose name I have said many times at this point, but for her speaking with me about what's going on at Elder Services of Worcester. Julie McMurray from the Alzheimer's Association, as well as Rona Shuchat and others from UMMACO. So thank you, everyone. And that is the end of my presentation.
Thank you so much, Emily. And thank you for bringing the humanistic side to your presentation, as well as the resources to help everyone online here. I saw a question from Dr. Visi about the resources that you presented. And I think specifically the ones from the Alzheimer's Association. Are those available for any type of dementia or specific to Alzheimer's?
They are, so they're available to all types of dementia, definitely.
I see a new question from Dr. Brown. Great talk, a lot out there about helping with burnout in caregivers like residents. It gets to some variation in treating individuals. Anything specific for addressing dementia caregivers burnout that you have found? So I think this is more from the provider side.
anything for addressing dementia caregivers burnout as a provider. I don't think I read any specific studies that were looking at caregiver burnout. I did read a lot of reviews that looked at for dementia caregivers, like just in general, and like looking at all the different interventions. But no, I didn't read anything specifically about like caregiver burnout and exactly like what intervention might be the best to help with that.
Not to put you on the spot, Dr. Benjamin, but have you come across anything like that?
I was just thinking as we were saying this, I don't know of any literature, but when you speak to different providers, neurologists and psychiatrists about taking care of dementia patients, sometimes there tends to be two different camps, people who say, there's nothing I can do, so I'll see you back in a year, or I'll refer you back to your primary care because I don't feel empowered that there's anything I can do. And then there's the other side, people like Dr. Federo here, who seek out ways to help the patients and the families. And so if you think about the symptomatology and empower yourself with all of these resources and other things that you can do, I think that helps with provider caregiver burnout or clinician caregiver burnout. So this is it right here.
I think the things that Emily outlined would fight burnout. Just having a community like all these resources she noticed. I think that's the whole point, is it gives caregivers a place to go.
And I don't see specific questions, but lots of praise for your presentation and for including the caregiver perspective, which was so helpful. And Dr. Yonker said, fantastic job. Come back to UMass when you finish. We need you.
Thank you. Thank you so much.
Any other questions? Sorry, Tony, you got cut off.
I just said that was a job offer.
Thank you. Yeah, we'll see after my fellowship, you know, what happens. Yeah.
It was a job offer and we do need you.
Okay, thank you.
You've been walking the UMass hallways for a long time. I think.
I know, like 8 years at this point. Yeah.
All right. Well, I don't see any other questions, but thank you again and congratulations. This is a milestone in your training.
Thank you.
I think people will want to see this video once it's online too, of today's talk.
Great work.
Yeah, this is a very helpful resource.
Great. Thank you so much, everyone.